Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment of kidney stones or renal calculi. Now we all know kidney stones because a lot of people suffer from this, and a lot of young men and women suffer from this, and it makes life miserable for them. So what are these renal stones? Normally we pass different types of minerals and different calcium, phosphorus, uric acid, and these sort of things. This usually dissolves in the urine and then it is excreted. But in a lot of patients, a precipitate forms in the kidneys, and then this gradually hardens, collects together, hardens, and becomes forms stones. So there are different types of stones, but the symptoms are common for all. Basically, when these start moving down, they cause renal colic, and they may get impacted in the ureters, and they can cause urine obstruction and infection in the urinary tract. In the long run, it can, if this is asymptomatic, then it can entirely destroy the kidney also, and there we have seen some cases like that, where big stones impacted in the kidneys and were painless completely, and no investigations were done. And in the long run, it was discovered only after there was significant damage in the kidney. So these kidney stones, in addition to the severe pain when going down, they can also cause long-term damage to the urinary tract and to the kidneys. Now, what is the treatment for this? There are two treatments. One is treatment in the acute phase when the kidney stone is passing down, and the other is in the chronic phase to completely dissolve the stone and to prevent it from happening. So what is the treatment? As I said, it is treatment is aimed at disintegrating the stone, flushing it down, treating the pain and the infection, and preventing recurrence. The usual time for this is around 4 to 6 months. So what is done in the acute phase? In the acute phase, we treat the infection, we treat mainly the pain because that is the main symptom. Sometimes I may be vomiting also because of the severe pain. So there is symptomatic treatment for the pain, and we try to make the patient drink as much water as possible, other liquids also, so that this water and the gravity will help to flush the stone as early as possible out of the body. Now we should know that the ureter is very small. It is only around 4 mm. So you can understand the physics. If the stone is more than 4 mm and it gets impacted, it can be blocked anywhere in the kidney outlet or in the ureter, and it can cause severe pain. There can be bleeding also sometimes in some patients. So bigger size stones may create bigger problems. So we give treatment to crush or break the stone, disintegrate it into small crystals or small particles, and then the large volume of fluid can flush it out. Along with that, in Ayurveda there is a special type of treatment known as Snehan. Now what is done is for around 7 to 10 days, when in the acute phase, the patient is asked to take large quantities of ghee, either alone or in water or in milk, warm milk, once in the morning on empty stomach and once at night on empty stomach again. Now this acts as a sort of lubricant, and it reverses the painful spasms, and it also helps to flush the stone out as early as possible. So this is the treatment for the acute phase. Now in the chronic phase, we give medicines to break or disintegrate the stone, and we also give diet diet instructions to the patient, so that the basic material which is causing the stones to form, that is also reduced. So usually you have to reduce oxalate high foodstuffs, usually non-veg items and dry fruits and so on and so forth. You can get details on the internet. Now, so diets and lifestyle is also important. So the person has to be active, do some regular exercise, and drink large quantities of water. So this is the long-term treatment for this, and usually the patient needs to be aware and alert for his or her entire life, and see that the stones are not formed. Patients who habitually have kidney stones are advised to do yearly checkup sonography, so that any stone can be located and treated as early as possible. So friends, this is a short description of Ayurvedic herbal treatment for kidney stones or renal calculi. Let's meet in the next video. Goodbye.